Welcome back. The doctor is in, and today it's geriatrician Dr. Chandini Sharma. She's here to talk about falls and how to avoid them in older adults. Dr. Sharma, good to see you. Welcome back. This is a very important topic and one that affects a lot of older people, correct?
Huge, 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 huge. And as we were talking earlier, your grandfather and his grandmother have not fallen because they've remained active.
Being active is a big part of it.
Huge part of it. So, I mean, one risk of falling is walking. One risk of walking is falling. So if you want to prevent yourself from falling, you've got to walk, but walk safely. And you've got to remain active, because if you're not active, you will lose those muscle strengths. I mean, and then you put yourself at risk of falling.
Tell me how dangerous a fall is for somebody that is older, that is a senior. It's not good.
The statistics sounds awful and real. After the age of 65, a fall that has taken you to the hospital can result in death in 1 year of about 20%. So 1 in 5 who've actually found themselves with an injury in the hospital may not even be alive after a year. That's huge, huge, more damaging and disabling than strokes.
Mm-hmm. What are some of the factors that can cause a fall like this?
I mean, it's almost like after the age of 65, the entire book of Harrison can cause a fall. But the more common ones are, let's just start with medication, medication, medication. The top 3 reasons is being medication. One thing, like we were talking earlier, was the Benadryl. Like anything, Tylenol PM, ibuprofen PM. PM is Benadryl. And geriatricians spell Benadryl as P-O-I-S-O-N.
Poison.
Poison. Because it can cause everything, confusion, etc., including falls.
So after the age of 65, do you recommend just not taking those medications?
Benadryl, no. Find a safer medicine with your primary care, which will help sleep if you have an issue with sleep. And that's a whole different topic, but find a safer medicine. Not just because you were taking Benadryl for the last 30 years and you continue taking it, don't take it anymore. But for falls, medications, osteoarthritis, because when the joints hurt, you just get up and you lose the balance. Vestibular system issues, that causes falls. Eye issues, that causes falls. As we age, the depth perception changes. So when you're coming down a step, you may not know how deep the step is and you misstep. Then of course, heart attack, rhythm problems, strokes, the muscle atrophy. As we age, when we're in our 80s, muscles get weak just by virtue of inactivity or whatever. And so decrease in the muscle strength then puts us at high risk of falling.
And quickly, what can people do? You mentioned be active.
Yeah.
You're not saying go become a professional weightlifter, but...
Nobody ever says that. I wish the senior care would say, oh, go to the gym. Don't go to the gym, just go walk.
Okay.
Walk, 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 walk. The other thing is that when you feel like you get up and you have that orthostatic blood pressure change, that your blood pressure drops and you feel a little dizzy, that's the time to get physical therapy. Okay. Don't wait for a fall to get physical therapy. You may have broken a bone already. So a fall or a near fall or gait imbalance, when you're just a little imbalanced, that's the time to start physical therapy. And don't just do physical therapy for the duration of 2 or 3 months and then say, oh, now there's no therapist, so I'm not going to do therapy. Once you've done therapy and learned what you need, active, active, active.
Okay, great tips. Dr. Sharma, thank you so much. We appreciate it.
Thank you.
Well, coming up, if you have a question for Dr. Sharma, email it to us at noonshow@griffin.news, or if any of the other doctors we have here on the Noon Show.